Hello everyone, welcome to Medical Education Nepal. Today we are going to discuss about the introduction to forensic medicine. So, first of all, what are the objectives of the session? So, what we are going to discuss today is given over here, the definition, the branches, the history and the importance of the forensic medicine, uh, followed by the medical jurisprudence, its definition, its importance, and some medical terms we are going to learn. The most important thing is we will also discuss the past year DU questions, Dhaka University questions, and we will try to solve them. Now, what is forensic medicine? So basically, forensic medicine is one of the branches of the law medicine. Law medicine has got two branches: forensic medicine and medical jurisprudence. So the word forensic, it comes from a Latin word forensis, which means forum. Forum is basically a Roman marketplace where people used to discuss the legal matters. So during the Roman time, where the people used to discuss the things that are related to the laws, those place is particularly known as the forum. So now, looking forward to the definition, it is the branch of the medical science that deals with the application of medical and paramedical knowledge to aid in the administration of justice. Now, here is paramedical knowledge refers to the related to the nursing staffs and all. So this definition is derived from Reddy book, and the another definition is it also deals with the medical aspect of the law. It also not it deals with the medical aspect of the law. Okay. So I have one more definition is given over here. It is also defined as the broad-based medical science that deals with the application of medical knowledge whenever and wherever it is required to take decisions in legal affairs, both in civil and criminal cases. So why it is called broad-based? So it is called broad-based because it deals with the dead body, living body, forensic pathology, as well as the clinical pathology. Sometimes in Viva, apart from the first two definitions, the teacher might ask you that is there any other definitions? So at that moment, we can say this definition is a broad-based medical science. So then after that, teacher might ask you why it is called broad-based. So these are the reasons. So it is called broad-based. Now, synonyms of forensic medicine. Forensic medicine is also known as legal medicine and state medicine. It depends upon the country. Like for Bangladesh, India, or Nepal, it is known as commonly we call it as forensic medicine. Even in England, it is called forensic medicine. And for state medicine, I guess it's called in Australia. Okay. Now, moving forward to branches of the forensic medicine. So forensic medicine has got a lot of branches. I've written over here: clinical forensic medicine, forensic pathology, toxicology, thanatology, and so on. So we don't have to learn all of these branches. We will just look at some of the important branches for third year. And to memorize these branches, I have given mnemonics over here: P square, T square, O cube, RBS, C, and CD. So it will be better if you guys memorize this in the similar pattern as I have given over here, like clinical forensic medicine, then forensic pathology, toxicology, thanatology. But if you cannot, then you can use this mnemonics. Now we will discuss each of the branches in a little bit of detail. Now, clinical forensic medicine, it deals with the medical legal aspect of the living body. The forensic pathology, it deals with the application of medical knowledge for determining the cause and manner of the death when the death is sudden, suspicious, and unnatural. Now, toxicology, it deals with the harmful effects of the chemicals on human beings. So, the forensic toxicology we will have to discuss in complete detail for as concerned for the third year, and we will do that in some another video. Thanatology deals with the death. Radiology deals with X-ray examination for determining the age, fetus, and fracture. Like in case of the dead body, for determining the age. Also for the diagnosis of the pregnancy, if there is fetus present in the uterus or not. So for this reason, radiology is here. Forensic ballistic. It deals with the investigation of firearms, ammunition, and the problem arising from its uses. It is also one of the most important topic for third year. we'll discuss in another video. Other branches are odontology, psychiatry, serology, dactylography, obstetrics, criminology, osteology, and nursing. These are not so very important, but you must know what do they mean, their definitions. Okay. Now, what is the history of the forensic medicine? So, the law medicine problems were first of all found in Egypt, Babylon, India, and China during the 4000 to 3000 BC. And the oldest known medical legal code is known as the Code of Hammurabi. Now, Hammurabi was the name of the king of the Babylon, and this code was found in 2200 BC. In 1302, the first medical legal autopsy was done in Bologna city of Italy by Bartolomeo di Vaignana. These all facts are important for your viva. These are sometimes asked by the teachers, so you must learn them. In 1502, judicial autopsy was done in Paris. 1602, first book on forensic medicine was published by Fortunato Perilli. And the father of forensic medicine, this is the most important thing, is the Paulus Jacquius. And the father of forensic medicine of the Indian subcontinent is the Dr. Jason P. Modi. Okay, so Paulus Jacquius is also known as the father of forensic psychiatry. Okay. Now the importance of forensic medicine, or we can say what are the aims or objectives of the forensic medicine. To aid in the administration of justice by correlating the medical knowledge and applying it to the purpose of law, to find out the medical evidence in all cases of crime involving the person, to find out the truth or the nearest reasonable approach, and to deal with the medical aspect of the law. Now, moving forward to the medical jurisprudence. Medical jurisprudence, the word jurisprudence has derived from two words, that is juris and prudentia. These are the Latin words. Juris means law and prudentia means knowledge. So it deals with the application of knowledge of law for the guidance of the members of the medical profession. It also deals with the legal aspect of practice of medicine. This is another definition. It is also known as Western medicine. So the father of the medical jurisprudence or the Western medicine is known as the Hippocrates. Now, what is the importance of the medical jurisprudence? It deals with the legal responsibilities of a doctor that arises from doctor-patient relationship, doctor-doctor relationship, and doctor-state relationship. Now, the teacher might ask you give some example of the doctor-state relationship. So you can say over here like the medical negligence cases, consent cases, rights and duties of a doctor, medical ethics, these all. And it deals with the legal aspect of practice of medicine. Now some medical terms. Ethics. It is a voluntary self-imposed code of conduct. Medical ethics. It deals with the moral principles that should guide the members of medical profession in dealing with each other, their patients, and the state. Medical ethics. It deals with the conventional law of courtesy that is observed between the members of the medical profession. Now, the differences between the forensic medicine and the medical jurisprudence. Forensic medicine, it deals with the medical aspect of the law, whereas the medical jurisprudence, it deals with the legal aspect of the practice of medicine. So first point is the definition, second point is the guide. Forensic medicine guides the judges, whereas the medical jurisprudence guides the members of the medical profession. Forensic medicine has got several branches, whereas the medical jurisprudence has got no branches. Forensic medicine is applicable to all people, whereas the medical jurisprudence is applicable only to the members of the medical profession. Now, one of the most important question, it is also asked in written, why doctors of all categories need to have a fair knowledge about the forensic medicine. It's because the doctors have to treat all kind of patients, including the medical legal patients. For example, the doctors of medicine have to give the death certificate in regarding the poisoning cases. The doctors of surgery have to treat the road traffic accident patients, physical assaults and injury cases. Similarly, gynecologists have to treat the rape cases, abortion cases, sexual assault cases, and the doctors also have to give their expert opinion in the court of law. And one more thing is, this is the one most important line, the teachers of the Department of Forensic Medicine, of The teachers of the Department of Forensic Medicine of government medical colleges have to deal with the postmortem examination and a victim examination. Now we will solve the past year Dhaka University question. Looking at the questions, I guess we have covered all of them. The first question, define forensic medicine. Yes, the goals of the forensic medicine, the importance, you can say, importance of forensic medicine, or goals, or aims, or objectives. These are all the same questions. The fifth question is the branches of forensic medicine. Yes, we have covered them. Sixth question is scopes of forensic medicine in Bangladesh. Okay, so for this question, you can write the importance of forensic medicine as given in the previous slide. But if you want to go more specific, then you have to give some another points as well. Like the doctors have to give the medical legal opinion. They have to find out the evidence in certain suspicious and unnatural deaths and applications of the medical knowledge for in the legal matters in both civil and criminal cases. These all points are given in your guidebook, so you can learn from there, or you can just write the importance. Okay, now uh, doctors of all categories. Yes, we have covered that. Forensic pathology, forensic thanatology. Yes, okay. So doctor-patient relationship. This is also one of the important questions, but this is not related to this item particularly. We will discuss this in another item. Okay. Now, medical jurisprudence definition, differences between. Okay, role of medical jurisprudence, its importance. Okay. So these are all the things. I hope you guys have understood it. Thank you so much.